Well, welcome back, everyone. You know, you may have heard the term dense breast tissue, but how does it impact breast cancer screening? Well, today we're joined by Dr. Weyer from Lima Memorial Health System to break it all down. So, Dr. Weyer, thanks so much for being here.
Thank you, Chris. Thank you for having me.
My pleasure. All right, well, let's start with the basics. What exactly is dense breast tissue, and how common is it?
Dense breast tissue is actually pretty common. About 40% of women have dense breast tissue. And basically what that means is this amount of parenchymal tissue within the breast tissue. And the only way we know whether a patient has dense breast tissue is by having a mammogram. And once we determine whether she has breast tissue or not, we then can give her additional options of additional modalities that we can do to better zone in on areas of concern, especially that dense breast tissue.
Okay, so for women that are told that they do have dense breast tissue, should they be concerned? And also, what does it mean for their health and also their breast cancer risk?
So it puts women about a 4 to 6% increase at detecting breast or at developing breast cancer if they do have dense breast tissue. So those patients who have dense breast tissue are at higher risk for developing breast cancer. So that is a concern. So there are additional imaging modalities like breast ultrasound that we can do in conjunction with the mammogram to zone in on areas within the breast tissue to determine and to make sure that there are no masses in there or areas of architectural distortion that may be missed on the mammogram.
Okay, so some women, you know, they may wonder if they need additional screenings beyond a mammogram. So what other options are there available, and when are they actually necessary?
Yes, if the patient does have heterogeneously dense breast tissue or dense breast tissue, at our facility and a lot of facilities across the country, they are offering ABUS or ultrasound. It's an additional imaging modality that will help zone in on that dense breast tissue to make sure that there are no hidden cancers. Another imaging modality that is used here at Lima Memorial as well as multiple hospitals across the country is breast MRI. That's a great modality. It's a bit more expensive, but it is a good modality of patients who have dense breast tissue to make sure that there's no hidden cancers in the breast tissue.
Okay, so if someone finds out that they do have dense breast tissue, what steps maybe should they take to stay on top of their breast health?
They should make sure that they have a screening mammogram once a year. Don't skip, because if there are any structural changes, we're able to detect it more clearly and easier if they don't skip their mammograms. And then we can also do an ABUS or a breast MRI to add additional information to make sure that there's nothing hidden in the breast tissue.
Okay, and if anybody wants to schedule a mammogram scheduling at Women's Health Center or at LMHS Wapakoneta Medical Center, you can always dial 419-998-4497 and then just choose option 1. So, Doctor, I really appreciate you coming out today.
Thank you, Chris. Thank you for having me.
All right, well, don't go away because we have more when we return.